If you have a chronic I don't feel gooditis, you probably also have leaky gut. And if you have an autoimmune issue, you definitely have leaky gut. Bottom line, if you've been searching for answers for your health, to answers for your health, and you landed here in my podcast or my YouTube channel, you probably have leaky gut. And while I'm not saying that leaky gut will solve all of your problems, you really can't move the needle on your health if you are not addressing this issue first. So, we're going to talk about what leaky gut is, how to know if you have it, and what to do about it. So let's dive in. Always, I start with the basics. I always start with an explanation. What is leaky gut? Leaky gut is also known as intestinal permeability. Leaky gut is a condition in which the lining of your intestines becomes more permeable, meaning it becomes leaky, it lets things in. Your belly has a natural lining that acts as a barrier, and it's supposed to only let certain nutrients into the system and keep all the bad guys out and foreign invaders out. When things are working well, the cells of your intestinal lining, the barrier, are tightly packed, forming a barrier that allows nutrients to pass through and keeps the toxins and other harmful substances out. That's called tight junctions. The problem becomes when the cells in the intestinal lining become damaged or weakened. Gaps develop between them, and this allows certain substances that shouldn't go through to go through, like undigested food particles, toxins, bacteria, and this leaks into your bloodstream. That is what leaky gut is. Now remember, this is a conversation of cells and molecules. These are not holes in your gut. You won't be able to see this on your endoscopy. So I just want you to know, so if you go to endoscopy and they say everything is normal, that doesn't mean you don't have leaky gut. Let's talk about what causes leaky gut. How could I possibly have leaky gut? I've been to the GI 1,000 times. They told me everything is fine. What causes leaky gut? Well, there's a few things that can cause. And of course, the most common thing is a poor diet. I know I say it every week. I'm sorry. There's no shortcuts. Processed foods, refined sugars, unhealthy fats, they damage the lining of your gut and make it more permeable, more leaky. This is why when I talk to my patients about nutrition, it's not about weight loss. It's about healing your belly. Another thing that causes it is chronic stress. Chronic stress, when you're under constant stress, it releases hormones like cortisol, which damages the lining of your gut over time, causing it to become leaky. And certain medications, NSAIDs, Motrin, ibuprofen, antibiotics, acid reducing drugs, those medications you take because you have that burning sensation, all of that actually contributes to leaky gut. These drugs disrupt the balance of bacteria in your gut, which leads to inflammation and damage of the intestinal lining of the barrier. This is why, if you're watching me and you see me in primary care, this is why I don't write antibiotics unless it's really, really needed, because I don't want to hurt your belly. Bacterial imbalances in the gut, such as like when it overgrows of harmful bacteria, what we call dysbiosis. If we have too much of the harmful bacteria or a lack of good bacteria, that can contribute to leaky gut. This is why I spend so many of my episodes talking about microbiome. If you haven't watched them, what are you waiting for? Go check it out. And here's another important thing that can cause leaky gut, and some people don't know this. If you had an infection or a cold or a flu or mono or Lyme, some type of illness, that can set off the leaky gut. It sets a cascade, which then messes with the lining of your stomach. And this is a critical piece because a lot of you come to me and say, I haven't been the same since. This is why. They'll say, ever since I had Lyme, ever since I had a cold, ever since I had COVID, ever since X, I haven't been the same. And for a lot of people, that X factor is the moment that their leaky gut started and triggered, and the cascade starts from there. Okay, so we know what causes it, but what does it do to my health? Like, what's the big deal? Who cares if I have it? Well, it's a big deal. Let's talk about it. Of course, I'm going to spend some time talking about how leaky gut causes autoimmunity, and many of you are here for that. But there are other things that it causes besides autoimmunity. First, kind of obvious, is nutrient deficiencies. When the gut lining is compromised, it interferes with absorption of nutrients from food, and this can lead to deficiencies in vitamins and minerals, which of course leads to other problems. Digestive issues, also kind of obvious. You have leaky gut, you're going to have more likely to have bloating, gas, diarrhea, constipation. All of that is because of leaky gut. And it can lead to the symptoms that people call IBS. So all those symptoms, But it also can lead over time, this constant inflammation can lead to IBD, which is more serious, inflammatory bowel disease. So we really want to get on that. Some things that people don't realize is connected to the microbiome or to leaky gut is skin problems. Leaky gut can contribute to skin issues, eczema, acne, psoriasis. Skin is belly, skin is belly, skin is belly. Maybe I should get a t-shirt that says skin is belly. If you have a skin issue, you have a belly issue. End of story. You have skin issue, you have a belly issue. Fix your belly, your skin will get better. Another thing that leaky gut causes is mood issues. There is so much evidence that mental health is connected to the gut. It's connected to your overall mood. It's connected to mood disorders. It's connected to depression, anxiety. Fix your gut and you fix your brain. Chronic inflammation. Leaky gut also causes chronic inflammation. And that's kind of like the hallmark of leaky gut. If I have leaky gut, I have inflammation. And so many of you will say, I just feel inflamed. I just feel like I'm constantly inflamed. It is probably from your leaky gut and the source of most of your inflammation. Now, it's not just how you feel, but that inflammation can cause cardiovascular disease, diabetes, cancer. So fixing this source of inflammation is super important. And of course, leaky gut can also cause immune dysfunction. So in addition to autoimmune, which I haven't even begun talking about, but it could also overall mess with your immune function, making you more susceptible to getting colds. So many people will say, I don't know why, I'm always getting sick, but every time I go to a medical provider, everything is fine. You might be getting sick all the time because your immune system is constantly dealing with your belly, and there's only so many battles that it could fight. And now we're going to talk about how leaky gut triggers autoimmunity. So many of you are here because you either have autoimmunity or you're concerned that you might be cooking an autoimmunity. If this is where you're at, we need to talk about leaky gut. Leaky gut triggers autoimmunity in two ways. Now, this gets a little technical, so stay with me here. Or you could fast forward and watch me on double speed, but this is important. I want you to understand why, because so many people don't understand the connection between, their autoimmunity, their rheumatoid arthritis, and their belly. How is it connected? It's totally connected. So there's two ways that your leaky gut affects autoimmunity. One is that it triggers an immune response. I'm going to explain what that means. And two is that it creates chronic inflammation. So let's start with immune response. This is where it gets technical, okay? So we said that when the lining of the intestines becomes leaky, it lets certain things in, toxins, bacteria, undigested food particles. So now this body sees these foreigners and it triggers an immune response. That means the body starts sending immune cells like white blood cells and antibodies to identify these guys and neutralize them. Now, usually this is a good thing. It's a great thing. The immune system is very good at identifying foreign substances. It distinguishes them from healthy cells and healthy tissues, and it attacks them. So when things are working well, the immune system's only fighting the bad guys, everything is good. But one of the ways it fights the bad guys, right, is producing antibodies. I think we all know that word these days. So antibodies means your body memorizes the bad guy, and when it sees it again, it's ready to kill it right away. That's what an antibody is. But with leaky gut, the immune system gets confused and starts to produce antibodies to your own healthy cells. That's what autoimmune means. Auto is self, immune. So the immune system is attacking the self. And this happens from leaky gut. This confusion, the fancy word for that is molecular mimicry, mimicking a molecule. The antibodies that work for one particle of something, like a food or something that shouldn't be there, now that same antibody is going to attack a healthy cell, a part of the body, because these two molecules look alike. They mimic each other. So the molecules mimic each other, and the one antibody that was created for one now starts to attack the other. Let me give you an example. A classic example, and I draw this all the time for my patients, is the molecular mimicry between gluten and the thyroid. For people with leaky gut, when they eat gluten, the body creates an antibody to that gluten, right? Because it's leaky, the gluten went into the bloodstream, the body's like, what is this? And it creates an antibody. But there's a protein in the thyroid that's similar looking to gluten. So that antibody that's produced to gluten is now attacking the thyroid. So every time you're eating a healthy whole wheat turkey sandwich and you're thinking you're doing the right thing because maybe you're not eating a hamburger and french fries, that gluten is actually causing a response, an antibody response to your own thyroid. And this constant attack leads to autoimmune destruction of the thyroid. And this is why we tell people with autoimmune issues to eliminate gluten from their diet, or autoimmune thyroiditis, to eliminate gluten because it helps reduce that constant attack and potentially can improve thyroid function. By the way, this is why I tell people to get a full thyroid panel test, not just a TSH, because when you're testing your thyroid, you can have these antibodies for years, decades, and the whole time your TSH will be normal. This is why it's so important. So that's how I explain the first part. Leaky gut triggers autoimmune, an immune response, that molecular mimicry to create the autoimmunity. But the other part that I told you, that second part of how leaky gut does it, is through chronic inflammation. So again, we talked about this immune reaction, this attack of foreign particles, this constant fight, the antibodies and all kinds of other cells that come in. It creates constant inflammation. Inflammation is a natural response from the immune system. It's supposed to be there if there's an injury or an infection or tissue damage. Short-term inflammation, good. We need short-term inflammation. It isolates, it repairs, and it moves on. The problem is when inflammation becomes chronic, every day, all day. That's when it causes a lot of health problems, including autoimmune disease. When you have a leaky gut, you have all these substances coming in, the undigested food, the toxins, the bacteria. Your body's constantly, agitated, and it produces not only antibodies, but inflammatory markers because they're trying to neutralize what they think is a bad guy. So this chronic inflammation leads to a constant activation of the immune system, which can trigger your autoimmune disease. This is classically in rheumatoid arthritis, people who have that joint pain, rheumatoid arthritis. It's an autoimmune disease that attacks the joints. These patients have inflammation, pain, and actual damage to the joint. People who have leaky gut have this constant inflammation that we just discussed, these constant inflammatory cells, and they start to attack the joints. So it leads to this chronic inflammation, this vicious cycle, inflammation, tissue damage, and ultimately the development and progression of rheumatoid arthritis. And of course, chronic inflammation can also break down the blood-brain barrier. That's a barrier that prevents substances from entering the brain. When the blood-brain barrier is compromised, you can have certain things entering that shouldn't, and that can contribute to the development of MS and other neurodegenerative diseases. So I'm hoping that I'm drawing a picture for you that leaky gut is a big, big, big effing deal. It triggers autoimmunity from molecular mimicry and from inflammation, and overall, it's a hot mess. So next question is, how do I know if I have it? How do I get diagnosed with it? And then how do I treat it? So diagnosing leaky gut can be challenging. And there's a few tests out there. There's two that I like. One is a zonulin test. Zonulin is a protein, and it's in charge of how wide, how leaky the lining is. Remember, because we need some opening, we need the nutrients to get in. So zonulin allows that opening to happen. We're supposed to have some zonulin, but for people with leaky gut, it's too open, and those patients will have an elevated level of zonulin in the blood, which we can test for. This is not done in regular laboratories. The I like to use is called Cyrex. I'm not affiliated with them. I have no financial ties to them. It's just a really good lab for this and other blood tests. Another way to test for it, instead of going through the blood, is to test the stool. A stool can check if there's imbalance in the gut microbiome that could lead to leaky gut. It also looks for markers of inflammation, the presence of harmful bacteria. And there's a really good test called the GI map. It's done by Genova. Again, it's a lab I'm not affiliated with, but it's pretty good stuff. So whether you choose to go the blood road or to use stool, there's ways to find out. And if you choose not to do any of these tests, you could just do an elimination diet and see if it helps. By removing the trigger foods and gradually reintroducing them, individuals can identify which foods can be contributing to their symptoms, and then you can develop a plan on how to manage it. Okay, so now we know how bad it is. We know what it could do. We know how to find out if we have it. Now let's talk about how to treat it. So one of the most important things you can do to help a leaky, you know what I'm going to say. You already know what I'm going to say. You need to change your nutrition. You have to eliminate trigger foods. Go, even if it's your favorite food, I'm sorry. You have to eliminate the trigger foods that are causing an inflammation. On the basic, you've got to get rid of gluten, dairy, processed foods, and sugar. That's like the basic thing that you could do for yourself. And of course, you have to add in the whole foods, the fruits, the vegetables, the healthy fats to support healing that gut lining. So you want to remove the stuff that's offending it, and you got to put in the stuff that heals it. I'm sorry, there's no shortcuts here. You have to start there. Of course, probiotics and prebiotics help. Probiotics are the good bacteria, helps restore the balance of the gut microbiome. Prebiotics are basically the food for the probiotics. Now, I'm not saying just to take supplements, although supplements help, but you want to consume like sauerkraut, kimchi, foods that are full of probiotics. And then prebiotic foods is onions, garlic, leeks, asparagus. Of course, if these things hurt you, don't eat them. Just because they're on the list doesn't mean you have to eat them. Another thing that can help leaky gut is digestive enzymes. Digestive enzymes can help improve the digestion and absorption of nutrients in the gut. They reduce the burden on the intestinal lining because they help move things along. So taking a digestive enzyme supplement with meals can help gut health and reduce the symptoms of leaky gut. Specifically, a great supplement for it is glutamine. Glutamine is an amino acid that plays a key role in maintaining gut health. It really helps that lining and it helps that barrier get strong. Omega-3 fatty acids, yes, it's great for heart. Yes, it's great for brain. It's also great for your gut lining. So take an omega-3 supplement. And after we talk about food and supplements, I need you to also think about stress management because chronic stress can contribute to gut inflammation, make the symptoms worse. And so you have to practice reducing techniques, yoga, meditation, deep breathing, because you could be eating all the gluten-free stuff in the world, but if you're level 10 all day long, your gut is going to have a hard time healing. So here's the recap. If you made it this far to my podcast or my video or this episode, you're probably not feeling that great. And there's a reason why you're here. You're either already diagnosed or you're on the search for a diagnosis. Wherever you are on the journey, fixing your belly is the epicenter. You have to start there. Leaky gut causes so many issues from GI upset to skin, all the way to autoimmunity. And I'm not saying fixing the belly is the only thing you need to do, but it's an important part of your treatment. And there's so much information out there, so you have to find yourself a guide. And if you want to work with me and my team, we are the New Method. New is spelled with a K because you always knew there was a better way. And we are just about on every platform. Let me put it up here. You can work with us at the New Method everywhere. Everywhere except for Twitter because I talk too much. Wherever you decide, whoever you choose to work with, I just want you to get better and find your path to health. I hope this helps. I'll talk to you guys soon. And remember, you always knew there was a better way. I'll see you next week.